Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and joining us today is Fairmont Medical Center's licensed clinical social worker, Annette Bramer. Thanks for joining us today on Speaking of Health, Annette.
Thank you, Jason. I'm glad to be here.
Well, I think we've all felt it at some point. I'm feeling a little blue or down in the dumps, and especially this time of year in the winter, we probably feel it even more. Depression is very real and can be very serious for some people, can it?
It is. It's a very serious illness, and I think that's really important to emphasize, is that it is an illness. So often the stigma is that depression is a weakness of character, and it truly is a medical illness that needs attention. It's estimated that up to 19 million people in the United States struggle with a depressive disorder every year. 25% of women, 12% of men can experience a major depression at any point in time.
That's a lot of people.
A lot. It's probably one of the most prevalent issue that brings people to the clinic. They often come in for other things, but in reality they are struggling with a mood disorder, and it can be very disabling.
So what causes depression? Is it something that happens in your life?
Well, the cause is really one of those mysteries. We believe that it's mainly caused by the neurotransmitters in the brain. The chemicals in the brain are not at the right levels, but other things certainly do play a part in causation of depression. So
are there triggers that can trigger that depression in your life, though?
Certainly. Unexpected life events, tragedies, trauma, or just day-to-day stressors, moving, financial issues, they can all build up and result in a mood disorder of some sort.
So what are some of the signs of depression?
Well, people normally think of just that prevalent sad mood, and that is common for most people. But for men, it might be more in terms of irritability, anger, maybe some aggression. Other symptoms are the lack of energy, feeling like you want to sleep all the time, or maybe you can't sleep at all. There's often changes in your appetite. Either you can't eat and you're losing weight, or you feel like you need to eat all the time and you're gaining weight. Anxiousness, restlessness, feelings of guilt when there's really no reason. A sense of hopelessness, helplessness. Unfortunately, then there are the risks of suicidal thoughts and suicidal plans. So there's many symptoms, and people don't have to have all of them to be considered depressed, but we do look at patterns and how long these symptoms have been part of their life.
So I talked about winter and maybe folks being even more depressed in the winter. Can that happen as well?
Certainly. Seasonal affective disorder is a very problematic, especially for those of us living in sunny southern Minnesota. I mean, it's just a special challenge to us when we have so few days of sunlight. And so it's something that certainly needs attention. It can be very debilitating. It can affect your relationships, your ability to get to work on time and to be effective at work. And so certainly it's something that we would want to pay attention to.
Is it something chemical in the body where there's the lack of sunlight that you see? Because so many of us, this time of year, we go to work, it's dark, we come home when it's dark.
Yeah, it's dark all the time. And so it does seem that it does affect our sleep-wake cycle. And it's like we can't get enough sleep. We're tired all the time. And interestingly, we tend to crave carbohydrates more when we're struggling with seasonal affective disorder. We tend to have a little more anxiety or restlessness. And so, we do believe it's connected to the lack of sunlight. But also there's that genetic piece. Like with any other depression, if mood disorders are in your family history, you are at a much higher risk of having a depressive disorder yourself. And so that's another kind of issue that you got to pay attention to as well.
So, I'm sure all of us have felt depressed at some point. When do you know that it's an actual serious problem?
Everybody gets the blues, you're right. We all feel down and out at some time, but typically, if you're struggling with the blues, they'll go away with the course of time. Talking to a friend, going for a good walk, just having other things to lift your spirits. In contrast, depression is one of those things that won't just go away. You cannot just pull yourself up by your bootstraps and get better. It is a physical illness that needs medical attention. And unfortunately, people tend to wait too long to get help. And it really impacts the quality of their life, their relationships, and they wait too long and they lose out on a lot of joy, which is really unfortunate.
So how do you get diagnosed with depression? How do you diagnose it?
Well, often people just come in and tell us that they have not been feeling well. And what's interesting is most people will say, I've been thinking about this for a long time. And in reality, we discover it is something that has been going on for quite a while. But you just simply need to make an appointment and come in, whether you talk with one of the providers in the psychiatry department, or if you come into your general practitioner. Talk to them, tell them what's going on. And that's the beginning. We do an assessment through an interview. Certainly, if there's other medical issues that could be causing part of the problem, we would want you to see your general practitioner to rule those things out, whether it be your thyroid or other hormonal issues. Let's take care of that. But if these symptoms linger on, we need to address it through perhaps some therapy or medications.
Can you be cured of depression? Is it possible?
Well, certainly. People go into remission where their symptoms more or less go away. But some people have somewhat of a cycle that it will come back. It will be a recurrent depression. And we certainly want to try to prevent that. For example, with seasonal affective disorder, once we see a pattern to the depressive cycle, we encourage people to start addressing it earlier in the fall or even late summer. Start treating it then so that you don't have to go through that dip in your mood and get ahead of it. Other people will just know that there are certain stressful times of their life that they need to pay attention to how they're feeling so that they can stay at their optimal level all the time.
I would think the top two ways to really deal with depression are probably therapy and medication, right?
Certainly. The two together are the most effective and something we would encourage. Talking about what's going on, paying attention to your thought processes. Depression is so much about negative thinking. And if we can attack that through therapy and build an awareness of what are your thought patterns and how do you handle them and how do they influence how you feel and what you choose to do. If we interrupt the negative thought patterns and replace them with optimistic and more positive, realistic thoughts, it's amazing how much better you can feel.
Is it also in therapy helpful for the patients to just get things off their chest, too?
Certainly. Say it out loud. Mm-hmm. It's amazing what revelations you can come to when you start talking out loud and hear yourself. You find some of your own stinking thinking is what we would call it, and you can realize, wow, I'm just way off. I can change this. And so it's problem solving with somebody else just to help sort through some of the difficulties. Medications
have advanced so far here in the last few years, right?
Mm-hmm. It's amazing. Even since I've been in the business, the new meds that have come on the market, and they are very effective. And I'm always amazed at the number of people who are so resistive to treating depression medically with medications. And I think the important point is to keep encouraging people to seek medical attention, just as you would if it were a pneumonia or a cancer or a heart disease. You would normally treat that with meds. Why not treat this medical issue with medications as well? And treat it aggressively. Follow your doctor's recommendations.
So a lot of people probably think, the misconception is anyway, that these are just my feelings and you can't fix that with medicine. But in actuality, you're saying it's an illness.
It's an illness. It is. And it needs, it benefits from medical attention. Treatment rates are amazingly effective. And you couple that with therapy and it gets even better. And it's not a forever thing for most people. Once we get things under control, medications can be tapered back. Many people go off of them. Now, some people do stay on lower doses of meds for a long time or maybe forever. But if that's going to help you have energy, stay focused, enjoy life, be a vital member of your family or your workforce, I think that would be worth it.
How about therapy? Is it something that someone would have to go to weekly for the rest of their life, or does it also maybe give them the skills in life to deal with their depression?
Exactly. Our goal is always to work ourselves out of a job. We don't want people there forever. So it is skill building, helping people build an awareness of what are my symptoms, what are my patterns, what can I do to make this better. So we try to build this toolkit more or less for our patients to walk out with, knowing I can handle this, I understand what depression or anxiety is, I know what to expect, and I know that I can effectively handle it. Sometimes with meds, and after a while, maybe without.
How about the age range for depression? Do you see it prevalent in a certain age group?
Well, we do tend to see more, obviously, in adults. First episodes are often early 20s, but children can get depressed as well. So it does go from very young to very old.
So any last words of advice for folks out there that might be suffering from depression?
Don't hesitate to come in. Seek out help, especially men. I don't know why, but men have a real hard time acknowledging that maybe they are struggling with a depression. And it's really unfortunate because it can negatively impact your job, your family, your enjoyment of life. But all people, if they are having some difficulties, call and let us help you out. At least ask the question and see what options might be available to you.
Another thing I also wanted to bring up, too, folks are going to want to avoid, if they are suffering from depression, drugs and alcohol.
Certainly. There is just that natural tendency to try to feel better any way that you can. And unfortunately, many people do self-medicate with marijuana, alcohol, other drugs. And unfortunately, all that's doing is making it worse.
Right.
Because so many of them are depressants. And so we're just kind of taking a bad situation and making it worse.
Right.
So,
trying to make yourself forget about what's going on with you doesn't help.
And unfortunately, it will often feed into that guilt feeling in the morning or the next day or later on. And then if there's legal issues that come with it, it just compounds the difficulties you're having. So, yeah, you're right. We do need to stay away from that.
And then exercise, being active, does that help?
Maintaining a set routine in your day, having a definite beginning and end, having a routine, eating healthy meals, avoiding excessive carbs when we're wanting to eat too much, because that weight gain doesn't help us feel any better either. Getting out in the sunshine, if you can, get your face in the sun whenever it pokes out outside. All of that can be real helpful.
All right. Well, great words of advice. Unfortunately, we're all out of time, but we want to thank Annette Bramer for joining us today on Speaking of Health. It was a pleasure.
Thank you.
And the phone number to make an appointment with one of the behavioral health specialists like Annette at Fairmont Medical Center, that number is 507-238-8598. Also, Annette will be giving a public presentation on depression and beating the blues on Thursday, January 28th in the FMC main classroom at 7 p.m. That is a free presentation and refreshments will be served. That's all the time we have, folks. Thanks, everyone, for listening. Have a great day and be healthy.